The learning goals of this video are to understand the advantages and disadvantages of the most common types of data analyses in RCTs, namely intention to treat or ITT analysis and per protocol analysis. As a subform of the per protocol analysis, we also have the so-called as treated analysis and the completers only analysis. Finally, different imputation methods are explained to show how missing values in datasets can be replaced. Randomization uses the principle of chance to assign people to an experimental or a control group. Unfortunately, not everything goes according to plan in studies after randomization. For example, it is possible that participants die before the study is finished. It is just as possible that they will move to another city, not take their medication, or simply no longer want to participate in the study. So what happens to their data during study evaluation? In an intention to treat analysis, all study participants are taken into account, regardless of whether they finish the study or not, and they are always evaluated in the group into which they were randomized, according to the motto, once randomized, always analyzed. This has the effect that the advantages of randomization are retained. Known and unknown prognostic factors of the participants remain evenly distributed between study groups. In addition, the results are more generalizable, because in real life, patients do not always behave according to plan. Intention to treat analysis is a conservative form of analysis. It tends to underestimate the benefits of clinical interventions and avoid overestimation of treatment effects. For this reason, intention to treat analysis is used in superiority studies. They assess whether a new intervention is more effective than placebo or an existing intervention. Per protocol analysis only takes into account participants who have always adhered to the study protocol. These are the ones who always received the intervention and who showed up for the checkups. All participants with protocol violations are excluded. Per protocol analysis tends to overestimate treatment effects. For example, people who stop treatment because they did not have any benefit are not taken into account. It can misrepresent the true study results if it is the only form of analysis. Therefore, both intention to treat and per protocol analysis should be performed. If the results differ significantly, this should be taken into account in the interpretation. As treated analysis is a variant of per protocol analysis. Here, the participants are evaluated as they were ultimately treated, regardless of the original group assignment. As treated analysis is used when the participants receive a therapy other than that assigned by randomization. This can be the case, for example, when comparing medicinal and surgical interventions, and some participants receive necessary surgery, although they are in the medicinal group. As treated analysis is primarily used to assess the side effects of interventions. With this type of analysis, the randomization is void. Completers only analysis is also a variant of per protocol analysis. In this form of analysis, only the participants who remain until the end of the study are taken into account. All others are excluded. The data of participants can be incomplete for various reasons. But what do you do if there is no data? Here is an example with blood pressure measurements at 3 points in time at which individual measurement data are missing. How can data gaps still be taken into account in an intention to treat analysis? So-called imputation methods can help if between 5 and 40% of the data are missing. This means replacing missing values. In this way, participants with incomplete data can also be included in the evaluation. There are two types of imputation methods: single imputations and multiple imputations. With single imputations, every missing value is replaced by one plausible value. There are several options for this. For example, the last observation carried forward method, the best observation carried forward method, or the worst observation carried forward method. Last observation carried forward means that the last observed value is used for all missing subsequent measurement times. It's an easy way to fill in the missing data. However, it is unsuitable if the disease progresses. For the best observation carried forward, the best of all observed values is entered instead of the missing values. And for the worst observation carried forward, missing data are replaced with the worst previous value. However, the assumptions in the context of single imputation methods are often unrealistic. There is also a high risk of having distorted results. Study results based on single imputation methods should therefore be treated with caution. With multiple imputations, missing values are replaced by several plausible values instead of just one. The advantage of this is that confidence intervals and p-values can be calculated with better accuracy, and the results are therefore less biased. We can conclude, missing data from participants can lead to incorrect results, and intention to treat analysis should therefore be performed in RCTs, and attention must be paid to the correct handling of missing values.